Certified Medication Aide Actual Exam Test Bank 2 Newest Complete Questions and Correct Detailed Answers. Question 1. In asthma, smooth muscles in the airways become severely constricted due to overstimulation. Which classification of medication will the client receive? Antidiarrheal, bronchodilator, anti-anxiety, antibiotic. Asthma causes bronchoconstriction, which narrows the airways. Bronchodilators, such as albuterol, work by relaxing the smooth muscles surrounding the bronchi, allowing the airways to open and making it easier for the resident to breathe during an attack or as maintenance therapy. Question 2. A resident had significant trouble swallowing their breakfast this morning. What is the medication aide's best course of action regarding their morning meds? Give the medication slowly with extra water. Call the healthcare provider immediately to change the order. Hold the medication and notify the nurse of the swallowing difficulty. Crush all medications and mix them with applesauce without asking. Difficulty swallowing, dysphagia, is a major risk factor for aspiration pneumonia. A medication aide, MA, must never force a resident to take oral meds if their physical status has changed. The MA should hold the dose and report the change to the licensed nurse, LPN/RN, who will then assess the resident and determine if a route change is needed. Question 3. A medication is ordered to be administered BID. The medication aide knows that the drug should be given twice a day, 4 times a day, every other day, every day at bedtime. BID is the Latin abbreviation for bis in die, meaning twice a day. These doses are typically spaced 12 hours apart, example 0900 and 2100, to maintain a steady level of the medication in the resident's bloodstream. Question 4. Which of the following statements indicates that a medication aide needs more education regarding the drug Cardizem XL? This medication may decrease episodes of chest pain, angina. Antacids can usually be taken at the same time without difficulty. The resident may experience low blood pressure, hypotension. The medication can be crushed if the resident has trouble swallowing. The suffix XL stands for extended release. Medications designed for slow release over time should never be crushed, split, or chewed. Crushing an XL pill destroys the time release mechanism, causing the entire dose to enter the bloodstream at once, dose dumping, which can lead to toxicity or severe hypotension. Question 5. To properly administer eye medication, drops or ointment, the medication aide should spray the medication directly onto the cornea. Apply the medication only around the outside of the eyelid. Pull the lower eyelid down to form a pouch and instill the medication. Ensure the medication is administered cold to reduce swelling. Instilling medication into the conjunctival sac, the pouch formed by pulling the lower lid, ensures the drug is absorbed properly. The MA should avoid touching the tip of the dropper to the eye or any surface to maintain sterility and prevent the spread of infection. Question 6. When administering ear drops, which of the following actions is considered incorrect? Position the client in the side-lying position. Follow the 6 rights of medication administration. Gently wipe the ear with a cotton tip if cerumen blocks the canal, after checking with the nurse. Disregard any minor redness or irritation noted at the site. Any sign of redness, swelling, irritation, or drainage at the site of administration must be documented and reported to the nurse immediately. These may be signs of a localized infection, an allergic reaction to the medication, or a worsening of the resident's condition. Question 7. When a resident refuses a medication, how should the medication aide document this on the MAR? Write a large X over the client's name. Write No in the signature section of the chart. Leave the space blank and move to the next resident. Place their initials in the box and draw a circle around them. The standard method for documenting a medication not given, whether due to refusal or being held, is to initial the appropriate time slot on the MAR and then circle those initials. The MA must also document the reason for the refusal and that the nurse was notified in the progress notes. Question 8. Which of the following medications is generally considered safe and appropriate to crush for easier swallowing? Tylenol, acetaminophen plain tablets, Inderal XL. Contact time release capsules. Enteric-coated aspirin. Plain tablets like Tylenol, option A, are typically safe to crush if the resident has dysphagia. However, extended release, XL, and enteric-coated, EC, medications should never be crushed. Note, while your flashcard listed D as the answer, in clinical practice, enteric-coated meds are specifically designed not to be crushed to protect the stomach lining. Plain Tylenol is the most common crushable med. Question 9. When a drug's action changes a resident's response in a positive or desired way, the drug is providing a dose-dependent effect, therapeutic effect, threshold effect, drug action effect. The therapeutic effect is the intended and beneficial consequence of a medical treatment or drug. For example, the therapeutic effect of an antihypertensive medication is a decrease in blood pressure to a safe range. Question 10. Potassium liquid is a high-alert medication that should never be administered without first being sweetened with sugar or honey, tested for purity by the nurse, chilled in the freezer for 30 minutes, diluted in water or juice. Potassium liquid is highly concentrated and extremely irritating to the gastrointestinal mucosa. If given undiluted, it can cause small bowel ulcerations or severe gastric distress. It must always be mixed with at least 4 ounces of water or juice to ensure resident safety and comfort.